Shock. Shock is caused by insufficient oxygen reaching vital organs in our body. Put simply, air goes in and out of us, blood flows round and round of us, which delivers oxygen. But when something happens to affect this process, we end up having less oxygen going round and round supporting our vital organs, which causes our body to go into what's known as shock. Shock can be caused by severe bleeding, heart problems, losing body fluids, severe allergic reactions, or infections. Symptoms to look out for are chest pain, irregular pulse, weak pulse, low blood pressure, cool, clammy skin, anxiety, pale or clammy skin, sweating, fast, shallow breathing, grey-blue skin, weakness, dizziness, thirst or nausea. We need to stop any bleeding. If there's any burns, we need to treat the burns. Reassure the patient, keep them calm. Lie the patient down and raise their legs. Also, bear in mind cold temperatures. To stop any hypothermia, it's best to cover the patient in a blanket, a duvet, a coat, use a jumper, anything just to keep the patient warm. Loosen any clothing and be prepared to act if the patient becomes unresponsive. For shock in pregnant women, lie them down on the left-hand side. This stops restriction of the blood flow to the heart.